Hi, welcome to our channel of IGNOU Audiobooks, Indira Gandhi National Open University, School of Social Work, SOSW, Diploma Programs, Diploma in HIV and Family Education, DAFE, BFE-101 Basics of HIV, AIDS, Block-1 Public Health and HIV, AIDS, Unit 1 Introduction to Public Health. 1.0 Objectives. On completion of this unit, you should be able to understand the history of medicine. Explain the background of public health. Describe what public health is. Explain the changing concepts of public health, and describe the healthcare revolution of curving the public health issues. 1.1 Introduction. Public health plays an important role in disease prevention efforts in both the developing world and in developed countries, through local health systems and non-governmental organizations. The focus of a public health intervention is to improve health and quality of life through prevention, treatment and management of diseases, injuries and other physical and mental health conditions through surveillance of cases and the promotion of healthy behaviors, communities and environments. The World Health Organization, WHO, is the international agency that coordinates and acts on global public health issues. Most countries have their own government public health agencies, sometimes known as ministries of health, to respond to domestic health issues. The public health system in India is managed by the Ministry of Health and Family Welfare of the Government of India, with state-owned healthcare facilities. 1.2 History of Medicine. In the evolution of medicine, medicine has drawn richly from the traditional cultures, biological and natural sciences, and also from social and behavioral sciences. In ancient times, health and illness were interpreted in a cosmological perspective. Thus, medicines were heavily dominated by magical and religious beliefs. The primitive people attributed disease, calamities and all human suffering was by evil spirits. People used different means to drive away evil spirits, such as appeasing gods by prayers, rituals and sacrifice, using charms and amulets, etc. At present in India, such practices are still continuing in the form of mantras, black magic. Indian medicines are mainly Ayurveda and Siddha. Ayurveda is traced back to the Vedic times about 5000 B.C. Park 2015. The medical history was associated with mythological figures, sages and seers. Ayurveda by definition implies the knowledge of life, witnessed tremendous growth and development during the Buddhist times. King Ashoka and the other Buddhist kings patronized Ayurveda as state medicine and established schools of medicine and public hospitals. Disease was explained as a disturbance in the equilibrium of the three humors such as vata, wind, pitta, gall, and kapha, mucus. This theory of disease is similar to the theory of Greek medicine of four humors. In ancient Indian medicine, hygiene was given an important place. It was also mentioned that the Indus Valley revealed advanced knowledge of sanitation, water supply and engineering. Likewise, the other indigenous system of medicines, namely, Unani Tib and homeopathy, were introduced into India by the Muslim rulers during 10th century AD. Today, Unani Tib and homeopathy have become part of Indian medical treatment options. Chinese medicines is based on two principles: the yang, an active masculine, and the yin, a negative feminine principle. The balance of these two opposing forces meant good health. The Chinese were early pioneers of immunization, where they practiced variolation to prevent smallpox. They have great faith in their traditional medicine, which is fully integrated with modern medicines. The practice of barefoot doctors and acupuncture have been famous worldwide in recent years. Egyptian medicine was far from primitive. Diseases were treated with a wide range of drugs. In the realm of public health, they excelled as they built planned cities, public baths and underground drains. They had knowledge of inoculation against smallpox, mosquito nets, etc. Greek medicine from early times to this day has applied the dichotomy between curative medicine and preventive medicine. The greatest physician Hippocrates, 460 to 370 BC, who is also called as father of medicine, studied and classified diseases based on observation and reasoning. Thus, Greeks gave a new direction to medical thought by rejecting the supernatural theory of disease. But later the glorious Greek civilization failed due to poor scientific knowledge, though they had scientific method, thus was succeeded by the Roman civilization. Roman medicine was largely borrowed from Greeks. Public health was born in Roman with the development of baths, sewers and aqueducts. There were fine roads throughout their empire, brought pure water to all their cities through aqueducts, drained marshes to combat malaria, built sewerage systems and established hospitals for the sick. Middle Ages are the period between 500 and 1500 AD. Due to fall of Roman Empire, the medical schools of Roman times were disappeared. This period is known as Dark Ages of medicine. When Europeans were facing the Dark Ages, Arabs took over and developed their own system of medicines known as the Unani system of medicine. The greatest contribution of Arabs was in the field of pharmacology. They developed pharmaceutical chemistry, introducing a large number of drugs, herbal and chemical. Later there was a turbulent in Middle Ages, where Christianity exerted a wholesome influence. The spread of Christianity led to establishment of hospitals. The first hospital on record in England was built in York in 937 AD. 1.3 Evolution of public health. The period from 1453 to 1600 AD was the revival period for medicine in the world. The 17th and 18th centuries were the period of discoveries of circulation of blood by Harvey in 1628, Leeuwenhoek's microscope in 1670 and vaccination against smallpox by Jenner, 1796, who had founded a new area in evolution of public health. During the Industrial Revolution of the 18th century, there were several problems like creation of slums, overcrowding with all its ill effects, accumulation of filth in cities and towns, high rates of sickness and death especially among women and children, infectious diseases like tuberculosis, industrial and social problems which deteriorated the health conditions of the people. The Great Sanitary Awakening, in the mid-19th century which took place in England was another historic milestone in the evolution of public health. It had a tremendous impact in modifying the behavior of people. The Great Cholera Epidemic of 1832 led Edwin Chadwick to investigate the health of the inhabitants of the large towns with a view to improve their conditions. Thus, the sanitary conditions of the labouring population in Great Britain, a landmark in the history of public health, set London and other cities on the way to improve housing and working conditions. In 19th century, cholera, which was often called the father of public health, appeared time and again, especially in the Western world. John Snow, 1848, an English epidemiologist, studied the causes of cholera and established the role of polluted drinking water in the spread of cholera. William Budd, in 1856, observed the outbreak of typhoid fever in the rural north of England, which was due to spread of drinking water. After these two discoveries, legislation was brought into force in England, namely, the Public Health Act of 1875. Sir John Simon, 1816–1904, was the first medical officer of health of London, was one of the prominent sanitary reformers. His efforts were directed entirely towards general cleanliness, disposal of garbage. His system of public health in England was admired and followed in different countries. This early phase, 1880 to 1920, of initiative in public health is addressed as the disease control phase. The development of the public health movement in America follows closely the English pattern. France, Spain, Australia, Germany, Italy, Belgium and the Scandinavian countries subsequently developed their public health. By the beginning of the 20th century, there was a broad foundation of public health: clean surroundings, clean water, proper housing conditions, control of offensive trades, etc. were laid in all the countries of the Western world. The concept of germ theory of disease breakthrough came in 1873, when the French bacteriologist Louis Pasteur, 1822–1895, demonstrated the presence of bacteria in air. He advanced the germ theory of disease. In 1877, Robert Koch, 1843–1910, showed that anthrax was caused by bacteria. Thus, the discoveries of Pasteur and Koch confirmed the germ theory of disease. It was the golden age of bacteriology. Microbes were also discovered in quick succession: gonococcus in 1847, typhoid bacillus, pneumococcus in 1880, tubercle bacillus in 1882, cholera vibrio in 1883, diphtheria bacillus in 1884, etc. All attention was focused on microbes and their role in disease causation. Thus it stopped the dogma and superstition and put on robes of scientific knowledge. 1.4 What is public health? Public health refers to the science and art of preventing disease, prolonging life and promoting human health through organized efforts and informed choices of society, organizations, public and private, communities and individuals. Winslow, 1920. The WHO Expert Committee on Public Health Administration, adapting Winslow's earlier definition, has defined the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community efforts for the sanitation of the environment, the control of communicable infections, the education of the individual in personal hygiene, the organization of medical and nursing services for early diagnosis and preventive treatment of disease, and the development of social machinery to ensure for every individual a standard of living adequate for the maintenance of health, so organizing these benefits is to enable every citizen to realize his birthright of health and longevity. Public health is an approach to concentrate on what we can do collectively, as a society, to assure the conditions in which people can be safe and healthy. The perception of prevention, promotion, curative and rehabilitation is seen as an integrated existence and just a division of medicine. It is a tool to understand the health status of a population by using different disciplines, for example epidemiology, biostatistics, social sciences, demography as a basic science of public health, and consequently help in influencing the policy and programs in health sector of a state looking at the priority basis. So, multidisciplinary is a characteristic of public health. With the adoption of the goal of health for all by members of WHO in 1981, public health is redefined as the organized application of local, state, national and international resources to achieve health for all, i.e., attainment by all people of the world by the year 2000 of a level of health that will permit them to lead a socially and economically productive life. According to Park, 2015, there are 4 distinct phases of public health. A. Disease control phase, 1880 to 1920. During 19th century, public health was largely focused on sanitary legislation and sanitary reforms aimed at the control of man's physical environment like water supply, sewage disposal, etc. Thus it was not focused on controlling any specific disease. However, such measures had improved the health conditions of people and control from infectious diseases. B. Health promotional phase, 1920 to 1960. A new concept of health promotion began to take shape at the beginning of 20th century. During the previous phase, individuals were neglected. It was realized that the state had a direct responsibility for the health of individual. Thus, health promotion of individual was added to public health. It was further initiated as personal health services such as mother and child health services, school health services, industrial health services, mental health and rehabilitation services. Later public health departments began expanding their programs towards health promotional activities. They promoted a provision of basic health services through the medium of primary health centers and sub-centers for rural and urban areas. The Bhore Committee 1946 in India recommended the establishment of health centers for providing integrated curative and preventive services. Later, Community Development Program was also introduced to promote village development through the active participation of the whole community and on the initiative of the community. But it failed to reach out to the people due to inadequate resources and limited time. C. Social engineering phase, 1960 to 1980. Due to advances in practices of public health, the pattern of disease began to change both in developing and developed countries as many of acute illness have been brought into control. But new health problems in the form of chronic diseases such as cardiovascular diseases, cancer, diabetes, etc. began. The concept of risk factors as determinants of these diseases became into existence, that gave a chronic burden on the society. Thus, public health entered into a new phase called social engineering, which needed reorientation towards the society. Public health moved into the preventive, behavioral change and rehabilitative aspects of chronic diseases. D. Health for All phase, 1981 to 2000 AD. In this phase, it is seen that most people in the developed countries and elite of the developing countries are enjoying all the health determinants such as education, adequate income, nutrition, safe drinking water, sanitation and comprehensive health care. Unfortunately, very few % of the population in developing countries could access to health services of any kind. Thus, there was a global awakening that the health gap between rich and poor within countries and between countries should be narrowed and ultimately eliminated. So, the neglected world's population too have an equal claim to health care, to protect from the killer diseases of childhood, to primary health care for mothers and children. You are listening to this audiobook on Audio Learn IGNOU. 1.5 Changing Concepts of Public Health. The two major branches, namely, curative medicine, and public health, preventive medicine, were evident at the close of the 19th century. The pattern of disease began to change to non-communicable diseases, the so-called modern diseases such as cancer, diabetes, HIV, AIDS, cardiovascular disease, mental illness and accidents came into prominence and have become the leading causes of death in developed countries. The realization began that there are other factors or causes in the etiology of diseases, namely social, economic, genetic, environmental and psychological factors which are equally important. Most of these factors are linked to man's lifestyle and behavior. Park, 2015. The germ theory of disease gave place to a newer concept of disease, i.e., multifactorial causation. Epidemiologists have significantly contributed the concept of multifactorial causes of diseases and risk factors in the etiology of disease. The development in modern medicine are conceptualized broadly under the following heads. A. Curative medicine. In mid-20th century, a profound revolution brought allopathic medicine, which has been defined as treatment of disease by the use of drug which produces a reaction that itself neutralizes the disease. The primary objective of curative medicine is the removal of disease from the patient, rather than the mass. Thus, it employs diagnostic techniques, treatment to accomplish this objective. The medical technologies have been tremendously developed due to changes in the nature, society, distribution of health and disease pattern in the community which help in developing specialization. Some specialities have emerged such as surgery, radiology, anesthesia, ENT, ophthalmology, cardiology, gynecology, pediatrics, geriatrics and obstetrics. Specializations has raised the standards of medical care, but it has simultaneously increased the cost of medical care and placed specialist medical care beyond the affordable cost of an average citizen. Specialization has further contributed to the decline of general practice and the isolation of medical practitioners at the periphery of the medical care system. B. Preventive medicine. Although the term public health has lost its original meaning, the terms like preventive medicine, social medicine and community medicine are used as synonyms for public health. The term preventive medicine comes from United States, when public health was almost exclusively concerned with the preventive infectious disease and was dominated by the medical profession. Preventive medicine is applied to healthy people, customarily by actions affecting large numbers of populations. Preventive medicine includes health promotion, treatment and prevention of disability. It is not only to prevent the occurrence, progressive of disease, disability, mental and physical, but also the timely application of all means to promote the health of individuals and of the community as a whole, including prophylaxis and health education. Initially, preventive medicines were in the field of bacterial vaccines and antisera, which helped in declining the morbidity and mortality from diphtheria, tetanus, typhoid fever and others. After the discovery in the field of nutrition, such as recognition of the role of vitamins, minerals, proteins and other nutrients, there have been added a new dimension to preventive medicine. New strategies have been developed for combating specific deficiencies such as nutritional blindness and iodine deficiency disorders. Further, the discovery of synthetic insecticides such as DDT, HCT, malathion and others have brought fundamental changes in the strategy in the control of vector-borne diseases, which have been among the most important worldwide health problems for many years. The discoveries of anti-malarial drugs, anti-tubercular drugs, anti-leprosy drugs and antibiotics have all enriched preventive medicine. Later in 20th century, the development of screening for the diagnosis of disease at preliminary stage has become an important part of preventive medicine. But preventive medicine is currently faced with the problem of population explosion in many developing countries like India, where uncontrolled growth of population is causing social, economic, political and environmental problems. It has further branched into new areas such as screening for disease, population control, environmental control, genetic counseling and prevention of chronic diseases. Scientific advances, improved living standards and education of the public have opened up a number of new avenues to prevention. There are 3 levels of prevention, i.e., primary prevention, secondary prevention and tertiary prevention. The primary prevention intended to prevent disease among the healthy people, secondary prevention attempted towards those in whom the disease has already developed, and tertiary to reduce the prevalence of chronic disability consequent to disease. In sum, preventive medicine is a kind of anticipatory medicine. C. Social medicine. The term, social medicine, was first introduced by Jules Guérin, a French physician in 1848. The background of the idea came from the French Revolution, which broke out in France and spread to Italy, Austria, Bohemia and Hungary. The revolution was aimed at establishing a new order and new society based on socialism. In 1911, the concept of social medicine was revived by Alfred Grotjahn of Berlin, who stressed the importance of social factors in etiology of disease called as social pathology. Social medicine can be defined as the study of man as a social being in his total environment. Social medicine reflected a concern with role of social factors in the etiology of disease and the need for governmental action in the areas of disease prevention and medical care. It is concerned with all factors affecting the distribution of health and ill health in populations, including the use of health services. It is an extension of the public health idea, reflecting the strong relationship between medicine and social sciences. Social medicine is an expression of the humanitarian tradition which includes care of patients, prevention of disease, and administration of medical services. Thus, social medicine is not a new branch of medicine but rather a new orientation of medicine to the changing needs of man and society. It emphasizes the strong relationship between medicines and social sciences. Professor Crewe of Edinburgh defined social medicine as, social medicine stand upon 2 pillars, medicine and sociology. Social medicine, by derivation, is concerned with the health of groups of individuals and individuals within these groups with a view to create, promote, preserve and maintain optimum health. The laboratory to practice social medicine is the whole community. The tools for diagnosing community ills are epidemiology and biostatistics, and social therapy does not consist in administration of drugs, but social and political action for the betterment of conditions of life of man. Social medicine is one more link in the chain of social organizations of a civilized community. D. Community health. The terms public health, preventive medicine and social medicine has been replaced by community health in some countries. A Euro symposium in 1966 defined community health as including all the personal health and environmental services in any human community, irrespective of whether such services were public or private ones. A. Family and community medicine. The emergence of family and community medicine has been a rediscovery of the human, social, local and cultural aspects of health and disease, and of the recognition of family as a focal point of health care and the right place for integrating preventive, promotive and curative services. Family-oriented medicine is applied to the care of patients and their families. It becomes the specialty of practice. Likewise, community medicine has also shared common ground. Community medicine implies activity at the local level rather than the national action abhorred by the conservative leadership of the medical profession. United States changed the name of social medicine to community medicine since social medicine sounds too much like socialism. In this context, community medicine is a practice which focuses on the health needs of the community as a whole. This, combined with primary health care, extends to the functioning of both elements to a healthcare system which aims to change the state of health of the community by intervention both at the individual level and in group level. Thus, diagnosis of the state of health of a community is an important foundation of community medicine. In most European countries, various aspects of community medicine are taught at medical universities in different names such as general practice, family medicine, community medicine, or social medicine. Check your progress. 1. Discuss the evolution of medicine and public health. 2. Explain briefly the different perspectives of public health. 1.6 Healthcare Revolution. The standard of health services was not provided to the real needs of people. A very high proportion of the population in many developing countries and especially in rural areas does not have ready access to quality health services. Rather, the health services favored only the privileged group and urban dwellers. It is considered that health is a fundamental human right, but there is a denial of this right to millions of people who are caught between poverty and ill health. Therefore, there are marked differences in health status between people in different countries as well as between different groups in the same country. To improve the health conditions of all sections of group, there is an increasing importance given to social justice, equity, recognition of role of community participation, changing ideas about the nature of health and development. A. Health for all, HFA. The fundamental principle of health for all strategy is equity, that is, an equal health status for people and countries, ensured by an equitable distribution of health resources. The member countries of WHO at the 30th World Health Assembly defined health for all as attainment of a level of health that will enable every individual to lead a socially and economically productive life. In 1978, the Alma-Ata International Conference on Primary Health Care reaffirmed health for all as the major social goal of governments, and stated that the best approach to achieve the goal of HFA is by providing primary health care. Park, 2013. It has been defined as essential health care based on practical, scientifically sound and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and the country can afford to maintain at every stage of their development in the spirit of self-determination. Thus, Alma-Ata Conference called on all governments to formulate national policies, strategies and plans of action to launch and sustain primary health care as part of a national health system. As a signatory to the Alma-Ata Declaration in 1978, the Government of India was committed to taking steps to provide health for all to its citizens by 2000 AD. It had laid down specific goals in respect of the various health indicators such as 1. Reduction of infant mortality from the level of 125, 1978, to below 60. 2. To raise the expectation of life at birth from the level of 52 years to 64. 3. To reduce the crude death rate from the level of 14 per 1,000 population to 9 per 1,000. 4. To reduce the crude birth rate from the level of 33 per 1,000 population to 21. 5. To achieve a net reproduction rate to 1. 6. To provide potable water to the entire rural population. B. Primary health care in India. Government of India launched a rural health scheme, based on the principle of placing people's health in people's hands in 1977. The healthcare delivery has developed three-tier system based on the recommendation of the Srivastav Committee in 1975. As a signatory to the Alma-Ata Declaration, the Government of India was committed to achieving the goal of health for all through primary healthcare approach which seeks to provide universal comprehensive healthcare at a cost which is affordable. Thus the Government of India evolved a national health policy based on primary health care approach and was being approved by Parliament in 1983. The National Health Policy laid down a plan of action for reorienting and shaping the existing rural health infrastructure with specific goals to be achieved by 1985, 1990, and 1995 within the framework of the 6th, 1980-85, and 7th, 1985-90, 5-year plans and the new 20-point program. Likewise, National Health Policy 2000, National Population Policy 2002, National Rural Health Mission 2005, National Health Mission 2013 with formulation of Indian public health standards have been taken up to curb the public health problems in India. See Millennium Development Goals. In 2000 September, representatives from 189 countries met at the Millennium Summit in New York to adopt the United Nations Millennium Declaration. The goals in the area of development and poverty eradication are now referred as Millennium Development Goals, MDGs. The goals are an integral part of the roadmap towards the implementation of the UN Millennium Declaration. The health-related Millennium Development Goals in India are: Goal 1. Eradicate extreme poverty and hunger. Target 2. Halve between 1990 and 2015 the proportion of people who suffer from hunger. To reduce the prevalence of underweight children under 5 years of age. Proportion, % of population below minimum level of dietary energy consumption. Goal 4. Reduce child mortality. Target 5. Reduce by 2/3, between 1990 and 2015, the under 5 mortality rate. To reduce under 5 mortality rate, probability of dying between birth and age 5. To reduce infant mortality rate. Proportion, % of 1-year-old children immunized for measles. Goal 5. Improve maternal health. Target 6. Reduce by 3/4, between 1990 and 2015, the maternal mortality ratio. To reduce maternal mortality ratio. Proportion, % of births attended by skilled health personnel. Increase uses of contraceptive prevalence rate. Reduce adolescent birth rate. Increase antenatal care coverage, 3 or more. Reduce unmet need for family planning. Goal 6. Combat HIV, AIDS, malaria and other diseases. Target 7. Have halted by 2015, and begun to reverse, the spread of HIV, AIDS. Reduce HIV prevalence among young people 15 to 24 years age group. Increase condom use in high-risk population. Ratio of children orphaned, non-orphaned in schools. Target 8. Have halted by 2015, and begun to reverse the incidence of malaria and other major diseases. Reduce malaria death rate per 100,000 in children, 0 to 4 years of age. Reduce malaria death rate per 100,000, all ages. Reduce malaria incidence rate per 100,000. Proportion, % of population in malaria risk areas using insecticide treated bed nets. Proportion, % of population under age 5 with fever being treated with antimalarial drugs. Reduce tuberculosis death rate per 100,000 at 2003. Goal 7. Ensure environmental sustainability. Target 9. Integrate the principles of sustainable development into country policies and programs and reverse the loss of environmental resources. Proportion, % of population using biomass fuel by 2012. Target 10. Halve, by 2015, the proportion of people without sustainable access to safe drinking water. Proportion, % of population with sustainable access to an improved water source, rural and urban by 2011. Target 11. By 2020 to have achieved a significant improvement in the lives of at least 100 million slum dwellers. Proportion, % of population with access to improved sanitation. Goals 8. Develop global partnership for development. Target 17. In cooperation with pharmaceutical companies, provide access to affordable, essential drugs in developing countries. proportion, percent, of population with access to affordable essential drugs on a sustainable basis. As the public health is concerned with disease prevention and control at the population level, through organized efforts and informed choices of society, organizations, public and private communities and individuals, World Health Organization identifies core functions of public health programs including providing leadership on matters critical to health and engaging in partnerships where joint action is needed, shaping a research agenda and stimulating the generation, translation and dissemination of valuable knowledge, setting norms and standards and promoting and monitoring their implementation, articulating ethical and evidence-based policy options, monitoring the health situation and assessing health trends. In particular, public health surveillance programs can serve as an early warning system for impending public health emergencies, document the impact of an intervention, or track progress towards specified goals, and monitor and clarify the epidemiology of health problems, allow priorities to be set, and inform health policy and strategies, diagnose, investigate, and monitor health problems and health hazards of the community. 1.7 Summary. In this unit, you have got the history of public health that has had a telling effect of challenges that threaten the health and well-being of the population. You have understood the role of government in addressing these challenges and achieving health equity by mainstreaming the public health agenda in the framework of sustainable development. You have gathered information about the ultimate goal of our nation for adequate access and availability of health care to everyone without division of rural and urban, where the governance is responsive, transparent. You have also gained the insight that there is necessary for intersectoral contributions to the health of communities, as the role of government in influencing population health is not limited within the health sector but also by various sectors outside the health systems. Thus, it is important that through community collective participation and intersectoral contributions along with government we will able to face challenges in dealing with public health issues and other social determinants issues. Therefore, this unit will orient the healthcare functionaries to understand the deep meaning of the present health policy in reaching the public health services at community level. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.